Hello, welcome to another video. I hope you're well. And in today's video, we're going to be talking about health inequalities and its relationship with quality and safety in healthcare. So let's have a little quick definition of what we actually mean by quality in healthcare. If you work in a quality and safety role, you might want to skip this bit, so skip the next minute. You'll be well rehearsed in this. So if you think about it, quality of care, I've got a lovely little definition here actually, is the degree to which health services for individuals and populations increase the likelihood of having good health outcomes. Simple as. And there's three key components: clinical effectiveness, patient safety, and patient experience. Patient safety is the science and practice, again, got a definition here, of minimizing harm and error experienced by patients whilst receiving healthcare. And they include a number of different things like complications, complaints, serious adverse events, never events, serious incidents rather, adverse events, never events, and then things like general harm, etc., etc. And the important thing I think to remember here when we talk about these definitions is that actually inequality and quality share one common theme, and that is they are everyone's business in healthcare. Just different spectrums, yes, but they are everyone's business. That's the one common theme that they do share. So that's the definition side of it. When we think about quality and safety and the wider determinants of health and well-being, what are the kind of things we're actually thinking about here? So if we think about it, when we go back to the health equity assessment tool training, one of the early things we talk about is that people's access, experience, and outcomes of care, so access, experience, and outcomes of care, are shaped by the wider determinants of health and well-being. So where you live, the geography, the air you breathe, your access to support, whether or not you're lonely or isolated, the amount of money in your back pocket, and loads of other layers too, such as cultural beliefs, your religion. There's loads and loads of layers to it, which makes it incredibly complicated. So yeah, access, experience, and outcomes of care are influenced by all of those things. And if they form the massive majority about what influences people's access, experience, and outcomes of care, then it's quite short-sighted not to be kind of mindful of that when we're designing solutions to healthcare that are of high quality and that keep people safe. So good quality care can be experienced unequally or inequitably. That's the key thing here. And the same can be said about any form of care at all. We know that people experience access and have outcomes of care unequally and inequitably, a lot of the times related to things around the wider determinants of health and well-being. But the real tricky thing here is that actually a disproportionate amount of harm related to quality and safety from healthcare will compound, will make worse the existing social or economic disadvantage for certain groups. And that actually go about exacerbating the very health inequalities that we're trying to tackle. That's a really, really key point. So a disproportionate amount of harm from healthcare will compound, make worse existing health inequalities experienced by certain groups. And we're going to look a little bit more into that shortly. So what we're saying is really here is viewing a quality and safety framework, policies, approach, method, rigor through a health inequalities lens is massively, massively important. Otherwise, it actually presents a massive chance to actually create some real tangible action around addressing inequalities through looking at a health inequalities lens. And it gives a chance for us to have, take some real ownership around addressing the health inequalities agenda as well. Unfortunately, it remains a fact of life that people are marginalised in society, experience racism and discrimination, and other forms of abuse that relate to specific characteristics around their age, their disability, and their race, etc., etc. So when we talk about health inequalities, we're also talking about the things that discriminate against people, sometimes intentionally, sadly, sometimes unintentionally. So yeah, that does remain a sad fact of life still, which again makes it even more important why we need to do something about that. So the same groups we talked about who are at risk of being marginalised are more likely to feel the effects of being harmed by poor quality healthcare because of a range of factors. And there might be like interpersonal factors or structural factors. And we're going to go through those right now. And hopefully you'll start to get a sense for why threading health inequalities into a quality and safety framework is massively important. So things like poor communication between clinicians and patients. So that can cause harm. If you think about it, for example, one in 6 people are on the hearing loss spectrum or deaf or are profoundly deaf. So there's a spectrum of 1 in 6 people who suffer greatly through not being able to communicate effectively with clinicians and patients. There's also groups of people who are more at risk in terms of their age. So children are more at risk of experiencing inequality and therefore present a much higher safeguarding risk as well. So that's just 2 groups. I mean, there's loads and loads of others. So there's also how health inequalities manifest themselves in the quality and safety arena. Creates lots of barriers and enablers here. So generally speaking, in the field of quality and safety, if people who can be involved generally will want to be involved. People who can be involved, can be the operative word here, will generally want to be involved. However, there are barriers people face that affect their capacity to be involved and to experience high quality care. So we may well be geared as much as possible to be able to provide a high quality experience of care that's very, very safe. However, there's no escaping the fact that there are people receiving that care, and there's things at play here which will affect their capacity to be able to experience good quality care. And there's things that within our gift to be able to change that. And there's things that we need to be mindful of and to slightly refine and adjust to be mindful of the things that might impact their ability to do that. We'll look at that later on. So what are the barriers and enablers? Barriers and enablers. There's how many characters? There's 1, 2, 3, 4. There's 4 kind of themes here around barriers and enablers for people and from a quality and safety perspective. So one around patient or carer's involvement and attitudes. So things like patient's health status is going to influence experience, outcomes, and access of care. Often this is age related, but it also relates to wellness and self-confidence as well. Other things like patient's proficiency in terms of language and health literacy. So think about health literacy. Definition of that is about a person's ability to understand and use information to make decisions about their health. A user with low health literacy will generally struggle to read and understand health information, know how to act, know which services to use and when to use them. So there'll be lots of examples in your own experience if you're a healthcare professional on the front line, but you may have heard of lots of stories where that kind of thing's really put under a lot of strain, and the reasons for that are a lot to do with health inequalities. Another reason people feel isolated or might not feel affected by the problem being put in front of them. That's going to certainly experience high quality or the capacity to deliver high quality care. There's things like issues of privacy, embarrassment, patient consent. That's definitely something that varies amongst different groups of our population, sometimes related to specific cultural groups as well. And then there's the ethical part of it as well. So ethics in terms of confidentiality, patients' rights to be anonymous and to get informed consent, and sometimes to take part in research as well. Taking part in research could be taken both ways. Could either contribute to higher levels of quality care, but a lot of people don't want to be part of a research program, which is fair enough. And then the final one to think about here is patients' time to be involved and to deal with the situation at hand. And that takes up a lot of time, energy and resource. And and they've got to try and balance that with other things going on in their life as well. So all of those things are going to affect quality and safety care, and in tandem, they're all influenced by the wider determinants of health and well-being. Second theme of barriers and enablers is around the relationship that health professionals actually have with patients. So we're talking here about things like a clinician's ability to communicate very well, to listen, encourage, and to instruct patients to do certain things, or to give an opportunity for people to ask questions and take part and engage in the care that's being planned for them. Now, there's loads of dynamics to that, especially when you put into the layers of things like cultural competence. Cultural competence plays a massive role in shaping the dynamics of communication. So the communication that you could have between people, between different cultures, could change quite markedly. So how people interpret what is said, depending on whom they're talking to, be that their gender or their religion, their ethnicity, the dynamics of that does change quite markedly. So yeah, that's one thing to be careful of. And professionals also need to be aware that not all patients want to or are able to participate safely. And that is what it says on the tin, and that's quite evident in how we see people respond to specific actions that are expected upon them. So that is something to be mindful of as well. And then finally, for the health professionals' relationship with patients, it's professionals' capacity to have a positive attitude, to encourage, support, and provide education safely in a high quality environment, to try and manage negative reactions from patients, and try and manage their involvement, and the types of questions they might ask them to elicit good quality responses, and their capacity to be able to build trust. And to be fair, it's a two-way street as well. A lot of emphasis on here and expectation is placed upon health professionals, but it is a two-way street. It's patient and the health professional who have to try and find that way of being able to get that nice balance, which is going to lend itself. And again, stressing all of these barriers or enablers are influenced again by the wider determinants of health and well-being. Third theme, brief one, this having clear definitions and understanding about roles and addressing inequalities. So what we mean here is this is about making sure that we've got any uncertainties removed around what health professionals think is their responsibility around addressing health inequalities. So you do that around making sure people are upskilled, making sure they're got time to be able to access protected learning time, the training, things like health equity assessments, that when it looks at things like cultural competence, that people are having got some really good quality understanding about what that actually means in practice. And there are, there's things like doing an organisational development plan to help identify how you might go about upskilling groups of staff in your organisation to be able to meet that. And the last one for barriers and enablers is providing the knowledge, clear information and communication to ensure that you've got a real high quality care in place that's safe. So when we're talking about knowledge, information and communication, what we're doing here is we're saying, right, okay, we know this is influenced by, again, the wider determinants of health and well-being. So things like access to knowledge information might increase self-efficacy, if that's how you say it. It might influence perceptions around risk, and it might influence people's propensity to want to act on something and manage that risk that they're being made aware of to be able to manage their health and well-being. And it also might influence people's ability to be able to monitor and detect and respond to risk. And actually, I'd argue that's both ways, that's for patients and for staff. And again, the dynamics of that are influenced by the wider determinants of health and well-being. So we know that's a fact because patients' capacity to be able to be knowledgeable and to retain information, communicate effectively, are affected by loads of different variables. So things like their educational background, their age and the language they use, the language they've been taught, their cultural background. And when I say cultural background, I mean that with relation to not just their ethnicity, but their general way of life in which they've been taught certain or developed certain belief systems, developed a set of values which matter to them, and actually wholeheartedly really focus on what their lens is through being able to manage their part in the world. And that will be different for them than it is for you or for me, for whoever it is. So if we take all of those little variables into account, not little variables, they're massive variables, and they're unique to people, it will impact people's capacity to feel adequately informed, to communicate effectively, to store and process information related to the quality of their care, and to keep people safe. And again, this stresses massively why being able to thread health inequalities lens into quality and safety is massively important. So there's a number of different ways and actions we can take to start to manage and mitigate the risks around on quality or high quality care and patient safety. I'm not going to go through all of the examples actually, because I might want to do that in a separate section actually. But let's think about it in terms of three different things here. One, you've got it around individually, so things you can do for people individually. Secondly, there's things around what leaders can do in healthcare. And thirdly, there's things around what we can do as a system collectively to be able to manage the risks presented around health inequalities and high quality and safe care. And I'm not going to go into details about the examples of that, because I want us to kind of dig deeper into that when or if you're going to be venturing into maybe doing a health equity assessment or developing some sort of quality framework. For now, I just wanted to give you a flavour for the kind of things, the kind of contextual things you want to think about when you're thinking about quality and safety and inequality, or our mission to achieve health equity. So, I hope that was helpful. I'd be interested in knowing what your thoughts are on any component of the video. So if you want to pop anything in the comments below, if you obviously I've done other videos. If you've not had a chance to look at those, then you can have a look at those. We looked at things like health equity assessments, briefly looked at co-production. But yeah, if you want to contribute here, it helps greatly if you subscribe as well. Leave your name in the comments and whatever comments and whatever thoughts you've got around this space. It'd be really, really good to hear that. But in the meantime, I hope you're well. Have a lovely day, whatever time of day you're watching this video, and I'll see you soon. I'll see you next week. Cheers.